If you are one of the millions of people who suffer with chronic nasal congestion, then I would like to talk to you for a few minutes and see if I can help you. We have a very innovative procedure that is called Vivaer that treats nasal obstruction. What is this procedure? This is an in-office based procedure that is non-invasive, that's using radiofrequency controlled heat to shrink swollen structures in the nose. How do you know if you're a candidate for this procedure? It starts with making an appointment with an ENT like me, so we can examine the nose and see if you have issues that this procedure treats. When you come to see me in my office, we will do what's called a nasal endoscopy, put a little camera in your nose, and we will examine all the structures that can be causing nasal obstruction. Vivaer specifically treats 3 structures that are very commonly causing nasal obstruction. First one, and I think that's the most common one, is called inferior turbinate. It's basically a swollen sausage at the bottom of the nose. And if that swells too much, it's really preventing your breathing. You probably have tried already with special sprays or maybe allergy medication try to treat it. But if the congestion persists, then this procedure might be for you. So swollen turbinates would be the first region that the Vivaer treats. A second region is an area that's called nasal septal swell body. Septum is a bone and cartilage. It's basically a wall in the middle of the nose. And even if your bone is straight, you can actually have significant swelling on the upper portion of the septum, almost looks like an apple. Again, this is nothing that you can see from the outside, but when we put a little camera in the nose, you and me will both be able to see it on my screen. It swells from inflammation. Third area that the Vivaer might be able to treat is an area of the nasal valve. Now, this is an area that's the narrowest portion of the nose. It's kind of right here at the apex on the inside. And many patients have very swollen tissue in this area. And also the area has a cartilage, and when the cartilage weakens, the nose collapses when you breathe in, and that causes a lot of nasal obstruction. So Vivaer procedure, again, treats all these 3 areas, and it's using controlled temperature heat radiofrequency to reduce the swelling in this area, and in the area of the nasal valve, almost to reshape some of the soft tissue and the cartilage, so it opens up a little bit more and it doesn't collapse as much. When we determine that you're a candidate for the Vivaer procedure, we will call your insurance and see if your insurance will cover this procedure. Most Medicare plans offer full coverage. Unfortunately, a lot of the commercial plans still think the procedure is fairly new, and we will offer you a possible self-pay price of about $2,500. I have many patients that completed the procedure both on the insurance and also as a self-pay, and they're all extremely happy about their results. And so patients always tell me, Dr. Suchanova, this was really worth it. So what's going to happen on the day of the procedure? Why I like this procedure is you can arrive by yourself. You are going home by yourself as well. You don't need a driver. This is a procedure in which I don't recommend taking any oral relaxation medication or very strong pain medication because it's not necessary. When you come to see me, I'll place a small amount of numbing gel in the nose and start numbing the front of your nose. Once we wait for about 5 minutes, I will place 1 injection on each side. It takes about 3 seconds to numb the deeper area where the cartilage is. That's the only discomfort that you feel. Once the nose is very numb, we actually move you to my relaxation procedure room. We are trying to create very nice atmosphere for my patients. We'll give you a pillow, a blanket, we'll play relaxation music as well. I think it's important for the patients to feel very comfortable doing these procedures. And once we have you set up, I will start treating one of the 3 areas. In general, start with the area of the turbinate. Again, what you're going to feel some warmth and maybe a little bit of a pressure. There is no pain during the procedure. I treat the turbinates for about 3 minutes on each side. I will then treat the nasal septal swell body, which is the swollen part of the septum. And then lastly, we will treat the area of the nasal valve. Again, you're going to hear beeping sounds. You're going to feel maybe a little bit of pressure and warmth, but you will not experience any pain. After about 10-15 minutes, the procedure is done. We watch you for about 5 to 10 more minutes, make sure that you are feeling well, and then you will go home. What to expect at home? During the healing phase, I always tell my patients, you're going to feel like you have a cold for 3-4 days. Why is that? Everything that we do in the nose, any procedure, the nose reacts with swelling first. The swelling peaks about the 3rd day, and then day 4 and 5, it becomes much more normal. The first post-op visit will be at about 10 days, and most patients are back to normal. What I ask my patients to do post-operatively is flush their nose with anti-inflammatory saline wash. It really helps the healing to progress well, decreases any of these cold symptoms as well, and also removes any crusting that may form. I also ask my patients to do a little bit of ointment, which is called mupirocin ointment during this time. The reason is, especially the area in the front of the nose can heal with a little crusting, And this ointment is very healing, really calms down the crusting and gives you a better recovery experience. When patients come for the second osteo visit at about 6 weeks' time, this is where the optimal results are really seen. It's my favorite visit because that's where my patients will say, "Doc, this makes a huge difference on my breathing." My personal experience with this procedure is most of my patients improve about 80 to 90% of better breathing. And the important thing that many times patients say, "Doc, it's not that I just breathe better, but I also sleep better and I just feel better as a whole." And I think I really want to mention this. Treating nasal breathing will not only make you breathe better, but the better breathing translates into better sleep, and better sleep translates into better quality of life. So if you have nasal congestion, nasal obstruction, if you can't breathe correctly, just make an appointment.